HIV symptoms in men and women after 1 week. HIV is a virus that targets the immune system of a human. HIV symptoms in men and women are mostly same, but vary from one person to another person. Early symptoms of HIV are mostly mild and can easily vanish after some time. But it is alarming because without any strong symptoms of HIV a person can transfer the infection to another men and women. This is the reason you should know if you have an illness. Since the initial HIV symptoms men and women experience are subtle, they sometimes go unnoticed. There are 3 stages of HIV infection. First of all, we will discuss the first stage or early stage of HIV symptoms. Here's a list of some common and early symptoms of HIV after 1 week, including those that are specific to women. Stage 1. Acute primary infection. In the early weeks after becoming infected with HIV, it's not uncommon for people to be without symptoms. Some people may have mild flu-like symptoms, including fever. The fever, usually one of the first symptoms of HIV. At this point, the virus is moving into the bloodstream and starting to replicate in large numbers. As that happens, your immune system induces an inflammatory reaction. Headache. The inflammatory response generated by your besieged immune system can cause you to feel tired and lethargic. Fatigue can be both an early and later symptom of HIV. Skin rashes and skin sores. Skin rashes can occur early or late in the course of HIV. In some cases, the rash can appear similar to boils with itchy, pink breakouts. Both men and women with HIV can get a yeast infection of the mouth, called thrush or oral candidiasis. It causes swelling and a thick, white coating on your mouth, tongue, and throat. Swollen lymph nodes. Lymph nodes often become inflamed or swollen when the body is trying to fight an HIV infection. Major lymph nodes are located in the armpit, groin and neck areas. You may experience swollen lymph nodes within a few days of HIV infection. Night sweats. Night sweats occur frequently in people with HIV. This is in the first few weeks though, and they usually disappear after this. Night sweats can be caused for many reasons though are necessarily related to HIV infection. Bacterial and yeast infections. Many women with HIV vaginal yeast infections often, 4 or more times a year. Sometimes they're the first sign you have the virus. They may also be harder to treat. Menstrual changes. Women with HIV can have changed to their menstrual cycle. Your period may be lighter or heavier than normal, or you may not have a period at all. You may also have more severe premenstrual symptoms. Stage 2. Chronic HIV infection. After the early stage of HIV, the virus moves into a stage called the clinical latency stage. This can also be referred to as chronic HIV infection. The virus is still active during this stage, but it reproduces at much lower rates in the body. During the clinical latency stage of HIV, a person may not have any symptoms. Some people who are not taking any medicine to treat their infection may remain in this phase for 10 or more years. Stage 3. AIDS. If a person has HIV and does not receive treatment, they may eventually progress to the late stage of the HIV infection, AIDS. The symptoms of AIDS can also be related to other illnesses. These are able to infect a person with AIDS due to their immune system being too severely damaged. Thanks for watching. Don't forget to subscribe our channel.